Hello, ladies and gentlemen. This is Rahul Koul, Chief Editor, BioVoice News, and I welcome you all to this episode of Face to Face. Advancing digital transformation can significantly reduce R&D costs and shorten drug discovery timelines. By combining human expertise with AI and robotics, a company can shorten the time frame of small molecule discovery without sacrificing the quality. So in this edition of Face to Face with BioVoice News, we have with us Dr. Kanury V S Rao, who's the co-founder and chief scientific officer of PredOmix, an innovation-driven company that is leveraging the power of artificial intelligence to develop new technologies in the field of preventive healthcare and early stage disease diagnosis. So now, without much ado, here I am with my questions for Dr. Rao. So Dr. Rao, please tell us that how can the combination of AI, big data, and other digital tools help in accelerating the cancer research? Over to you, sir.
Well, thank you, Rahul, for that generous introduction. So when you talk about big data in the context of biology, particularly human biology, what you actually mean mapping changes or patterns of large numbers of biomolecules. This could be DNA, proteins, metabolites, and so on. So big data is important because you're capturing a wider landscape of biomolecules that are present in the human body. And since disease often, always involves biochemical changes in the body, the initiation of a disease or development of a disease is marked by changes in relative levels of those biomolecules. So at one level, when you talk about big data, you're talking about mapping all the small molecules. And now if you bring in digital tools to look at the data and help you interpret whether those changes are related to the establishment or development of a disease or not. So that's where big data gives you a high resolution map of what's happening in the body, and combining a digital or AI-based tools allows you to interpret what those changes means, particularly in the context of disease. So that the same principle then also extends to cancer detection, because cancer, of course, also induces a lot of changes in the body. Its causes can be genetic and environmental, and all of those are reflected in terms of changes in the biomolecules. I'm just calling them biomolecules. They could be DNA, proteins, metabolites, RNA, and so on. And then if you use intelligently these digital tools, you can use them to detect cancer very precisely, and perhaps more importantly, at a very early stage. So that's how these two arms combine to help you to identify, detect diseases.
So how is PredOmix enabling preventive healthcare to be more powerful through use of new age technologies such as artificial intelligence?
Right. So if you talk about chronic diseases, these could be diabetes, heart disease, cancer. These are diseases that evolve over years. And in all of these cases, you can only detect them once they're fully formed and established in the body. And this is particularly true of cancer. In most cancers, early stages, you don't know you have it. By the time you discover, unfortunately discover you have the disease, it's a much later stage where treatment options are limited. On the other hand, if you detect it, say, in a very early stage, you can reduce death rate, by as much as 70% or more. So currently, in the absence of very effective drug, the best thing you can do is come up with technologies to detect cancer at an early stage. And that's what PredOmix has been focusing on. And again, our strategy has been to combine big data with artificial intelligence. The only thing is, in big data, the class of molecules that we monitor are called metabolites. These are small molecules like glucose and cholesterol and so on. There are thousands of them, and these are all products of the biochemical reactions in the body. So our rationale was, since disease, including cancer, is accompanied by biochemical changes, those changes will be reflected in changes in patterns of metabolites, and therefore these metabolites become immediate reporters of the occurrence or progression of cancer in the body. And so we generate data on, we thousands of these metabolites in a human's blood sample. And then we integrate that with our own internally developed artificial intelligence algorithms. At one level, the algorithm analyzes these and extracts signatures that indicate whether there is cancer or no cancer. And if cancer is found, there's another set of algorithms that come in to identify what type of cancer it is. So that's broadly how we have approached the problem of uh, early detecting cancer at an early stage, and with the hope that that can then save many, many, many lives. Yeah.
Right, right. So, what makes your product, which is OncoVariX, so unique, and what has been your expectations and response so far?
Right. So OncoVarix, of course, is basically the same platform that I talked about, because largely the focus on cancer detection, particularly what is now coming up as multi-cancer detection, that is, in a single test you can detect multiple cancers. Focus has been largely on DNA and proteins and so on. Whereas we chose to focus on metabolites, and like I said, so in a single assay in our first stage of development, we successfully could detect the 4 women-specific cancers: ovarian, endometrial, uterine, and cervical cancer. And early stage, particularly stage 1 and so on, we got remarkable accuracy with that. I mean, that's of course integrating that with our artificial intelligence algorithm, which we had developed specifically for this purpose. So that's a remarkable accuracy for stage 1. So that's something very, very exciting. And talking to clinicians in the field, they said this is something, early stage cancer detection is something they desperately need, because then they can also positively impact on patient lives through improved prognosis. So that's been, in that sense, it's exciting. And so now we are actually bringing it out as a laboratory developed test. It's a single, all it needs is a very small amount of blood, less than an ml of blood. And in one test, you can detect whether you have a lady has any of these 4 cancers. And even if it's in a very, very early stage, which you can't detect by traditional means. And the accuracy is about 98% plus. So that's how we're trying to enable at least early cancer detection of the 4 prominent cancers in women. Yeah.
So it's a very layman question, that is early stage disease diagnosis really possible through digital technologies? I mean, at what stage it is, and how is the company enabling it currently? Is it only in context of cancer research, or also some other disease areas? Multiple
No,
questions
so
I'm asking.
we have focused on cancer at this point because it's a large enough problem already. So while it is possible for other disease, for sure, for instance, autoimmune, down the line, we'd like to also look at neurodegenerative disease and so on. But our current focus is on cancer. And yes, like I said, we are able to detect even stage 1 cancers with a very, very high accuracy. So it's not digital technology alone, but we believe the strength of it is we pick the right class of molecules to monitor, which are the metabolites. As these are endpoints of body, the biochemical reactions in the body. So any change in the health state is either due to or causes changes in the biochemical reaction, which then reflects in changes in patterns of metabolites. So I think our approach is what clicked. And of course, then the ability to develop very, very high sensitive AI tools that can actually very accurately pick patterns that identify whether these changes relate to cancer or not. So that, I think that's been the USP of our technology. So far, and we are hoping to build and capitalize on it further in the years to come.
Right. So, which are the other areas of innovation that you intend to keep focusing on, and why so? And ongoing R&D projects which are being spearheaded by the company.
Right. So, like I said, I mean, it's okay. The first thing is what we realize is we have kind of hit upon something very, very powerful, the strategy of integrating metabolomics with artificial intelligence. And it can have a variety of applications, but our immediate focus remains on cancer, and particularly in terms of expanding the scope of the platform that we. So currently, what we are in the process of doing, and I just completed a pilot study. In the same test, now we can simultaneously detect 32 cancers across both men and women. So these are all the prominent, right? So the pilot study is completed. Again, the sensitivity accuracy is very, very high, and we are in the process of initiating clinical trials, in order to validate and also, get approval for the test. So that we think will be a good advancement, because now you're bringing more cancers under the scope of or ambit of your test. So that's one level. I mean, is the other thing, of course, even in cancer, there are other problems. For instance, if you identify somebody with cancer, the question is, will he or she be responsive to the standard first line of treatment or not? Because those also have important implications for progress. So that's another area we can enter, or we partly entered into. Also, when somebody is undergoing chemotherapy, can we use a technology to track when the person is cured or not, to protect that individual from unnecessary toxicity and so on. So these are some of the other layers we can add on, and that's something we would look at once we finish the clinical trials for the 32 cancers.
Right. So do you have any other products other than OncoVariX? And I mean, what would be the key features and expected launch of such products?
So currently, our focus is on launching OncoVariX. We have another very interesting product that actually can predict whether you'll get a heart attack or a stroke in the next 1 to 3 years, and that looks at a separate set of these. Now look for specific biomarkers. And so we can see the problem with heart disease is that, it's a multifactorial disease. There are too many factors. Currently, we just focus on triglycerides, LDL, HDL, cholesterol, blood pressure, and so on. But there are many other risk factors. And so what this other test does is complements the existing analysis we do for risk factors like age, smoking, weight, LDL, lipids, and so on. It also captures, risk factors that are present even in people without atherosclerosis or without any other vulnerability. So, it helps enable the spectrum of risk factors we're capturing. So that's another test we have. But at this point, we're focusing on bringing and developing the cancer test. And as we go along, we may start, because that still needs some clinical trials to do. And as a startup company, you're working in a focused manner because your resources are not as big as you would like it to be. Yeah.
True. And how are you addressing the affordability criteria for these products? I mean, will they be affordable in the longer run, or?
In the longer run, we hope it will be. Initially, they are. I mean, see, it depends on, it's. I guess for middle class, it's okay. Yeah. But yes, as we obviously, once it gets into the market, gets some traction, we would like to bring the prices down, so that, because the advantage is a blood test, right? So I don't need to go anywhere. Even if I want to do a mammography for breast cancer, if a lady wants to do it, she has to go to a clinic or some, a laboratory, get a mammography. The beauty of this test that we have is you can sit at home and order the test, and somebody will come to your house, collect the blood, send it back to the lab, and you get your report by email. So it's something you can, do at home. So the convenience factor is also there. And we recognize that with that, we have, there is strong potential of going into tier 3, in addition to tier 1, tier 3, even the rural areas and so on. And although, and the problem of cancer is there also in rural areas, because access to healthcare is so detection is even at a later stage. So, as we build and, generate some, strength and traction, we would like to bring the cost down, or work with even governmental agencies to extend this into, let's say, smaller towns and other settings. Yeah.
So what would be the approximate cost of this product? I mean, just an approximate.
Yeah. Currently, the cost is around 12,000, but we're introducing it at a 50% discount of 6,000. But again, like I said, once the R&D costs, whatever investment costs are recovered, and as volumes build, then we would definitely focus on bringing the cost down much more.
Sure, sure, sure. I hope that the product gets to the markets as soon as possible. And
Yes, we do.
now I'll also shift to another important topic, that is partnerships in our industry. I mean, academic and industry collaborations, which were not in fashion that much earlier. Nowadays we are seeing a lot of them. I mean, in terms of technology transfers, a lot is happening. So are there any partnerships with national and international organizations and academia and industry at your level?
So as I said, our first phase actually is concentrating on India. India is a large enough market, and so we are actively looking to develop collaborations with clinicians. So we have one collaboration set up already with the Mahavir Cancer Research Center in Patna. And there's a question. So what we actually see, our approach for this is, okay, we have our basic test. Now we talk to the oncologists and other clinicians. What in your view is the major issues that need to be addressed, right? So one such issue came up, say this is in the case of cervical cancer. This is our collaboration with the Mahavir Cancer Center. Is that okay? We get cervical cancer, and then we give them the standard first line treatment, but there's always about 20 to 30% of people who don't respond. That's a problem for the non-responders, because while they're undergoing the chemotherapy, they are suffering the toxic consequences, the toxicity consequences. But in that time, the cancer is also progressing. The question was, okay, is there any way to identify before and predict who will be a responder and who will not be a non-responder? So that's the collaborative project that we are doing, and the initial results are very, very encouraging. At least about 95% accuracy we can predict, but we need to add more sample numbers. So that, I think, is an important question across all the cancers, right? Because it has implications, particularly of people who are not going to respond because their prognosis becomes poorer for it. So that's one thing we would like to now partner with other hospitals for, adding this layer on for the other key cancers. That's one. And again, like I said, when people are undergoing chemotherapy, when do you know that an individual has been, or at least is, cured, or at least significant remission? That is something we are hoping we can again track with our technology. So we are now, right now the focus is developing our technology, protecting the intellectual property, all those things. But now we will actively be looking from, the later half of this year to collaborate with clinicians in India, and particularly to collaborate around what they think are the key questions in cancer care that they struggle with, and can we help in that? Then that becomes a layer we add on to our technology. So automatically that becomes a pipeline that benefits the patients on a wider spectrum.
Right, right. And how is your company managing the funding at the moment? Are you planning to raise some funds in the longer run?
Yes. So at the moment we are funded by angel investors. At this point this will take us to the end of the clinical trials, and then hopefully we get drug controller approval. That is probably in the first quarter of 24 is our plan. And once we do that, then we plan to go for a Series A round. So that, because then we want to expand our market activities in India on the one hand, and while that is being established, we would also now like to explore, particularly the UK or USA, for bridge trials, and then can we introduce the product there.
Right, right. And sir, where do you see the company in the next 5 years' time? What are your aspirations and longer term goals?
Yeah. So next 5 years, my immediate dream may be that we become, a complete, a solution point for cancer detection and prediction, right? That is what I mean by that, detecting even, so a screening platform to detect early in the population. Say if you're high risk, we can, it becomes a screening platform for people at high risk because of age, genetic mutations, family history, and so on. So, the moment cancer, hopefully, unfortunately, if it develops, we catch it very early and offer a good problem. But beyond that, the layers that add in terms of, okay, we can also, based on our own internal analysis of the metabolite profiles, can we identify the best treatment course and downstream analysis. So the comprehensive 360-degree platform for cancer detection and at least first line, resolution, improving prognosis. That's one dream in India particularly. And of course, it would be great if we can penetrate, like I said, the lower income segments and the less metropolitan segments and so on. And the other level, we would also like to establish a presence in at least in either USA, Europe, UK, one or more of those territories, and a couple of other territories. So if in 5 years we can do that, that will be a good contribution.
Point well taken, sir. My last question is, how do you look at the startup ecosystem, especially the biotechnology startup ecosystem in India? Do we have enough, support from the government, and what has been the sector doing of late?
Well, to be honest, I think the brain power is there, right? See, I've been an academician, and I always claim that our students are some of the brightest worldwide, having taught students in other countries, including the US and so on. I have a lot of respect for our students. Again, to what extent you can liberate them intellectually and give them the courage to set up and innovate, right? You can see the challenge, we can talk about innovation, but to promote that, you and me have to have the ability to recognize what innovation is, right? If I'm reviewing somebody's project, I use the familiar benchmarks, and I very often I can't recognize innovation, right? So I'll put it this way: if I come up with a fintech company or any other service-based company saying that, okay, I have this model, it'll work better than Flipkart or Amazon or whatever, investors have a benchmark, right? And they can evaluate, okay, are you really better? But if I say I have an out-of-the-box idea, if it does break through, so that's a lot more risk-taking from investors or other things. So that appetite for risk, needs to come in to really promote imitation. Yeah, I cannot say we'll get innovative in our country unless we promote that appetite for risk, because innovation is a very space.
Absolutely right, sir. So it was a pleasure to have this conversation today with you. A lot of insights. I wish very best to your company, and we hope that the product will be soon in the market. A pleasure to have you, sir.
Thank you so much, Rahul. Thank you. My pleasure to talking to you. Yeah. Thank you.
Bye-bye. Thank you so much.
Bye.
Dear audience, thank you for watching this discussion. We will be soon back with the next episode of Face to Face. Keep watching this space and keep following us on our social media handles. Thank you.